The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the most popular cosmetic procedure, and we're talking about liposuction today. What you need to know if you're considering this procedure. With us, we have one of the busiest cosmetic surgeons in Southern California, Dr. Tom Barnes. Dr. Barnes, welcome to the program.
Thank you, Randy. It's great to be here.
All right, a lot of media attention with you.
Yeah, we've been fortunate. And what we try to do in our practice in Newport Beach, California, we try to stay up on the very latest. Now, you mentioned liposuction. If I could correct you,
okay.
I like to say facial and body contouring. In other words, have the body you always wanted, whether it's a little bit of stuff or whether it's a complete makeover. That's what we try to do for
people. On the phone, you said to me, you said,
yeah.
Randy, the results we're getting today are so much better than we used to get.
Absolutely.
Why is that? I mean, what's changed, I should say?
A lot's changed. You see, one day we were doing liposuction. I started this 15 years ago in Newport Beach. And we would just do the cannulas. My patients say, I don't want that cannula thing going like that. Well, we have so much more now. We have Smart Lipo that's come in the last 3 or 4 years, and I've been doing that. I've been teaching these techniques to other doctors.
We should mention that. You help other doctors learn how to do these techniques.
Okay. Well, hopefully to do it right. Okay. Because number one is patient safety. Number two is helping people achieve their goals, the goals they want, not the goals I want, the goals they want. That's my job. That's what I do. Okay, so let's say a little bit more about this. We have Smart Lipo. Fabulous. But lately I've been doing something else in addition called Tickle Lipo. I know it sounds funny.
Yeah, that sounds gimmicky to me, by the way.
Yeah, but it's not.
It describes what? The
well,
feeling
basically, it's a vibration of the cannula. So instead of this plunging, the vibration causes the fat to loosen, in simple words.
Is it sound waves? What is it? Ultrasound?
It creates an infrasound, it's called. Creates a sound wave is set up, and it's less traumatic. And instead of this hard pushing, it's like playing a violin. We remove the fat. Now, if somebody has a lot of loose skin somewhere in their body, I may choose to add my Smart Lipo laser in addition to get additional tightening of skin. Now, that's very important. If you're 30, 35, you probably don't need that. If you're 50, 60, 70 years old, I'll often do the two together. I customize the work.
For people that don't know you, you do more than just what are the different procedures you do in your practice?
Oh, we do facial work. We do all facial work. We do eyelids. We do all the different lasers. I have 12 different laser and light-based devices for wrinkles, for making the skin look better. Anything from non-invasive, like photofacials and so forth, all the way up to the CO2 laser, fractional CO2 laser, all of these new things I do as well. But in addition, I do my sculpting of the neck. I call the
You love the neck.
Love it. Lunchtime neck lift. I'm guessing I do more than anybody in town. Because I love it. I can get great results.
Technique to it?
Totally technique. Everything we do is technique. I'm glad you brought that up.
Okay.
We get a lot of calls today because there's all these people coming in from other fields and so forth, the way the recession is and so forth. People seem to think if you have a Smart Lipo device, you do it as good as somebody else sells tires.
Okay.
It's not a commodity. It's still the singer, not the song. If you have a device...
I do see results, by the way. I mean, I've looked at your results.
Thank you.
And I try to tell people that, look, go to somebody that does a lot of it, and look at their results.
And has happy patients.
Not everybody's doing it the same way.
Happy patients.
Okay.
That's
and I'm not trying
to
endorse you, by the way.
Anybody can just suck some fat out, but having it sculpted and beautiful and a happy patient, it changes their lives. I have people continue to lose weight, 20, 30 pounds, after I just do a small area on them, because people get excited. You see, when you see these news stories about bad cosmetic surgery, that's the wrong story. They should be talking about all the wonderful effects, making people happier, energizing them.
Who should do it?
Inspiring them.
Who should do it?
Well, I should do it.
Okay.
As much as I can do it.
So you come from the standpoint, if you don't like a certain part of your body or whatever that can be taken care of, it's okay.
This is what we call desire medicine.
Desire?
Desire.
Interesting.
It's not like having an appendix out. Somebody comes in, there's something that's been bothering them forever. I will give them an honest assessment. This is what I would do, and these are the options, making sure they're healthy and so forth. We do all of that. Then we offer them options, and we help them select what
I've been
works
told somebody
for
goes
them.
in for a facelift for you, and you say, no, you only need neck lipo.
Is
that true?
Very commonly, almost every day, someone will will come in and they'll say, somebody else said I need this, this, and this, and it frightens me. And I'll say, well, I do those things, but why don't we start out with my lunchtime neck lift, which is a sculpting procedure, and then I use my Smart Lipo or Tickle Lipo, depending on what I think is the best choice to get them their result.
Okay.
Then away we go.
Let's start with the neck. You brought some photos, but you think the neck, and
Number
I'm
one.
smiling because I like your enthusiasm here. I mean, you like this stuff. But the neck, you say it makes a big change in your appearance, makes you look younger.
Yeah, I call it the beginning of the checkup from the neck up. We start with the neck.
Okay.
People will come in and remember, look at your parents. You want to know where your neck's going to be in 20 years, 30 years? Look at your parents. It's a big genetic
Well, that's
component.
nice, okay.
Yeah, I'm sorry, but it's true. Select your parents very carefully. Okay, so let's start with this lady right here. You see, here's a neck. Now let's address this. Okay. This lady comes in, nice lady. She says, my neck's been bothering me. I feel I look tired and overweight. And she wasn't overweight, but she had this full neck. Okay. So I offered her our lunchtime neck lift, which we did. And you can see in the after picture.
Neck lift. What are you doing, by the way?
Well, actually, I'm doing a little bit of sculpting.
Okay.
I may use my Tickle Lipo if I think it's appropriate.
For people just tuning in, we're talking about this sound waves.
Yeah.
It's called Tickle because of the way it feels.
Yes. Maybe I'll call it nutational infrasonic liposuction.
That's what it really is.
That's what it really is.
Yeah, call it Tickle instead.
And by the way, I know the science and the physics because I teach this to other surgeons.
Okay, good.
Just as I have taught Smart Lipo over the years and liposuction for years. So as I was saying with our first case, this woman, about 48 years old, comes in and she's got a full neck. She says, holidays, I don't like my picture because if it's on a side shot, I look fat, she says. I look tired, and I'm a realtor, and I don't feel competitive with all the young people coming up. I said,
Do they
okay.
say that on the consults?
I hear it all the time.
Wow.
There's many reasons, personal reasons and professional reasons that people have a minor change in contouring, and it can really have dramatic effects in their lives. It can change the way they eat and exercise just by doing a neck, because people get inspired.
Interesting.
So what we did was I removed a little fat with my sculpture technique. Now, it's not just, let me do a little liposuction. It's a sculpture technique where I go all the way up the side of the face, usually awake, and people are just fine in about 30 minutes. Then I put some...
Like just local anesthesia?
First, I put the tumescent fluid in there.
Fluid? Okay.
Yes. And safety is number one. Now, you look at her after shot. Now, look at the tightness she has. Okay? Look at how she looks happier.
Looks like a facelift.
Yeah.
I mean, not like a facelift. She looks much different.
Well, it looks like many of these cases look like they've had the neck lift without having the cutting surgery, the downtime, and the expense. That's why I call it my lunchtime neck lift.
Okay.
Yeah. 30, 40 minutes.
Okay.
Okay, they're on their way. That night
so it's like 30 or 40 minutes.
They're on their computer that night, taking care of their children.
Already thanking you. Dr. Barnes, it was great.
Well, they're probably thinking about it. But just as important, I will have women come in, men too, and say, we've got little kids at home. What should I do with the kids? I'll say, just work right through it. You can go home and cook dinner tonight. They'll say, really? I'll say, yeah, absolutely. That's our technique.
Do you think the neck makes the biggest change as far as appearance?
I think the neck and the eyelids, because the eyes are the seat of the soul, and the neck is how you literally lead through life. And if those things are tuned up, as we say, or beautified, even if it's not major work, it can have a huge impact.
What about the guy? We're going to take a quick break.
Okay, our gentleman here.
That's a young guy, right?
Yeah, he's young. He's about 35 years old. He comes in. He's got that fullness. Again, he just looks tired. And there's a bias in our culture against carrying extra fat. It's unfortunate.
Okay.
There is a bias. Okay. And if you can just slim that down in 30 minutes, it can change his life. That's what we did.
He looks good.
Thank you.
Probably looks good in the shirt and tie.
He looks even better in a shirt and tie.
Okay, we're going to take a quick break. And these photos, by the way, if you're just tuning in, we're talking about what's new in liposculpture techniques.
Body contouring
techniques. With us, we'll probably have one of the busiest cosmetic surgeons in Southern California, Dr. Barnes, Newport Beach. And after this, we're going to show some of the women what you can do, even for their thighs. Very interesting.
We're going to talk about just about anything that somebody could want.
All right, we'll be right back. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, the hottest topic in cosmetic surgery. We're talking about liposuction, but as Dr. Barnes calls it, lipo contouring. Says it's more than just sucking fat. He's trying to educate me here today. Now, again, for people that don't know you, one of the busiest guys, probably, and I know the busiest guys. You're probably the busiest guy I know in the world of cosmetic plastic surgery. And you think less is more sometimes too.
Less is
Very
absolutely more. Absolutely. We do the big facelifts. We do full body lipo. I do the brow lifts. I do all that. But if I can help somebody achieve their goal doing a smaller procedure, 2 or 3 little smaller things, I'm happy. Maybe I'll see them again in 3 or 4 or 5 years. I have people drop in all the time 8 years later saying, look how great my neck is. I was in the building. I'm still happy. I go, great. And that makes me feel good.
Okay.
That's why I do this.
You love this stuff.
I love this.
Okay, now we've talked about neck. Very popular area. What else?
Another biggie, my Poochie sculpture, we call it, and it's always my lower tummy lunchtime tummy lift. We call it that too, because people understand tummy lift. So if we look at this before and after, now she's got that Poochie. Do you know there are a lot of women in their 20s and 30s, they won't eat if they're going to the beach in a bathing suit.
Really?
Because the pooch will stick out more. This is what I have found out. I'm going to write the book someday. I know the secrets. And in her Poochie in 30 minutes, this is her a few days later. She's ready to go. No Poochie.
In a dress, that must look good.
In a dress, it looks great.
Flat stomach, always looks good.
Interestingly enough, women who are older, maybe 40s and 50s, they'll say, look, I just want to look better, or I want to match up my size 6 top to my size 8 bottom. I want to get to a 6 and a 6.
Is that right? Very good point.
Huge problem. They'll come back from Nordstrom.
Can they match it up? Have you ever had that happen?
Yes, they'll come back from Nordstrom and say, look, this is the first time I've ever been able to wear a match set. That's right. So maybe we do their Poochie, maybe they do outer inner thighs, their calves, whatever it takes to help them meet their goals.
The most expensive part about this procedure is all the new clothes they have to buy?
Well, that's what the husbands tell me.
Now, do you see, though, that they come in with a renewed self-esteem or a different feeling about themselves or dressing differently?
Yeah. It's people get inspired. And I remind them, I helped them, they did it. They made the decision to take control of their lives. Something bothered them. They said, and I commonly hear this from women, I just want to do this for me. I deserve this. I've waited long enough.
Okay.
We help them meet their goals. Maybe in a few years they'll come back from something else.
Are there triggers that get them to do this? I mean, a reunion, a marriage, somebody, they saw a picture of themselves.
Yeah. Very commonly reunion, which backs up at us because someone will come in and say, in 2 weeks I'm flying to Miami and I have a reunion, my 30th reunion or whatever. I've only got 2 weeks. And I say, people out there, if you're hearing me, give me 3 or 4 weeks. Come in, give me a little wiggle time because Murphy's Law. We want to be sure that you're tuned up. Everything looks good, whether you did your upper and lower eyelids, whether you did a little mini facelift, whatever you did, we want you ready for your event.
What about the overweight person? You're not going to turn them away, or you are?
Well, number one is safety. So if someone has any health issues, we always make sure that they've seen their internist or family practice doctor to get cleared before we do anything.
50 pounds overweight, they've tried diet, exercise, they still can be a candidate.
As long as they're healthy.
Okay, good.
Okay.
What about fit people? Because I can't help but look at that over there.
Fit people are fabulous. Now, overweight people, by the way, 40, 50 pounds, we have done amazing cases where people will be contoured and then they'll continue, as I mentioned before, to lose another 20, 30, 40 pounds on their own. Like a famous newscaster that I worked with, now we've become friends, about 3, 4 years ago.
Could you mention his name?
You know who he is.
Okay.
And we did his neck and his jowls. And he got so excited, he continued to lose an additional 50 pounds. And he got back into swimming and surfing and a lot of things. Yeah.
So it's like leverage.
Oh, he looks fabulous. And it makes me feel good to know that I've been able to help somebody inspire themselves.
Okay, good. Good.
Let me show you another picture. Now, here's a gal who's a little more fit, okay? Now, her inner thighs drove her nuts. I say drove her nuts.
Oh, I see that. Okay.
I say drove her nuts because we changed all that. We also did her outer thighs, and I'm going to show you that. Okay. We also did her tummy. Okay. All right. And I'm going to show you something. The difference 1 day later with Tickle Lipo. Awake.
Okay.
No discomfort. People laugh. Because of the vibration under the skin, they actually laugh on the table. Next day, can we show you now?
Yeah, let's take a look. Let's take a look.
The very next day, look at that.
Nice.
No bruising.
So the inner thighs, though, I hear that's a tricky area.
Very, very tricky. Upper arms, inner thighs, in my opinion, because I teach this to other surgeons. Very tricky, very easy to leave dents and so forth. And very often dents can be filled. It means another procedure in the future to fill them. But it's really an artistic area. You need to have the science down as a doctor cold, because safety is number one. I keep saying that.
But for thighs, we're talking about thighs. Very tricky area.
Very tricky.
Okay.
Number two, easy to leave dents, easy to take too much. If you take too much, you're not doing anybody a favor. It has to be sculpted. It has to be seamless with the rest of the body.
Because that's smooth, by the way. That's not
Very
touched up,
smooth.
right?
No.
And that's the next day.
Not. Next day. Now, here's why I like Tickle Lipo so much. Less bruising, less swelling, get people to work faster. And by the way, I was the first doctor in California on the West Coast to use Tickle Lipo. I started about a year ago. But sometimes I'll still use Smart Lipo. Body contouring, not liposuction, because I choose custom
So
work.
it's a combination of techniques with liposculpture that you're doing.
And the more experience a physician has, the more he knows, gee, if I do that or if I do this, I can help them achieve their results.
Is that fair, by the way, to ask a doctor? It seems like I'd be uncomfortable to say, how often do you do liposuction or liposculpture?
Absolutely.
Ask them.
Absolutely.
Because most guys I know, that maybe if they're doing one a month,
No,
because they don't like to do lipo.
Well,
you do it every week?
Some doctors might do breasts all the time, and they might do lipo a few times a month. I do anywhere.
Every week you do it?
Well, I do between 5 and 10 cases a week. It just depends on whether it's busy season or not, and that season can
change. So what are you trying to do, get smooth results that nobody can notice? I mean, what are your goals when you're doing this?
My goal is for someone to look better, but nobody can tell they did anything.
All right. All right.
That's my goal. And for them to get back to work faster, not have discomfort during the procedure or after, and feel they were taken care of.
What does she say? Because that is an incredible result. I mean, when you look at the inner thighs, it's subtle, but it's huge.
Yeah. Well, she's pretty happy.
She looked like an exerciser before. Probably just couldn't get that area. Is that
That's right. Good point. Some people just they're great shape, but little stubborn areas of fat, and I have more to show you. Maybe love handles, maybe outer inner thighs, maybe a little poochie, and they're perfect candidates because when you're in better shape, you heal better.
Okay. Okay. What else are we looking at here?
Well, let's show you a lady that's a little bit bigger, where we do a little bit more. And you see on her before, she's got poochie just about everywhere. And you see her after. Now, my goal wasn't to make her skinny. My goal was to make everything match, okay, to her body. So we removed the poochie, we removed the upper, and look at those ripples on the side of her torso.
Under her bra. Very
bra line. So now we talked about neck, lower tummy, inner outer thighs, but that bra line gets a lot of women. Mid-back. Hey, what about armpits? Front and back armpits keeps many women from wearing cocktail dresses. That's an area, it's a small area, very important.
So in this rear view...
Yeah, you see, she's smaller, but she's now in balance.
She has tan lines on the after, by the way.
Well,
are they out and about now?
She's out and about. She actually went down to Bora Bora, is the truth. She gave me about 4 weeks to get down to Bora Bora, and that's what I mean. Please, ladies, give me a little more time, but we'll get you there. We'll get you there.
All right. Now, on the consult, okay, so when they go in, what are the frequently asked questions? I mean, what do they want to know? What do they ask every time?
I would say number one is will I have discomfort? Okay. And that needs to be addressed. That needs to be addressed. That's why I try to keep up. I go to many of the major meetings to find the latest technologies to make it better for my patients. And I'll go back to Tickle Lipo. It's better for them.
Okay, great. We're going to take another quick break. We come back. I know you have men. You have for their chest as well. You call them what?
We're covering them? Man boobs, moobs, he-hooters. We're going to cover it all.
Okay. You're watching The Wellness Hour. We'll be right back.
We did liposuction on my hips, a little bit up here on my back, on my tummy, on my arms, and I was awake throughout the whole thing. And the day after I had it done, my husband went with me, and Dr. Barnes took the bandages off, and our jaws literally just dropped because it was instant. It was instant, and it looked amazing. And he was like, you still have time to heal. You're still swollen. And my husband was like, I'll take you the way you look right now. You look great. So it was an awesome experience.
I feel great. My confidence level has boosted up a lot more. I'm doing things that I wasn't doing before. I'm going to the beach. I'm riding my bike, working out a lot more, eating healthier. And I found in my own personal life, it hasn't just been a body transformation, but a transformation of the mind and spirit as well.
I feel a lot more confident with my body now because I had a couple of family traits that no matter how much diet and exercise I did, I couldn't get rid of. It's a great big lump on my thigh, and I couldn't wear shorts. And it's just a really awful thing to live in Southern California and not be able to wear shorts. So now when it's hot out, I can put on my shorts and go.
He was able to go ahead and show me how he could take it out of my knees, out of my inner thighs, and then I was able to discover the stomach as well. And that was absolutely miraculous. Very easy. It was remarkably easy. It was virtually painless. I was back to work in a couple of days. I did laundry that night. That's how easy it was.
When I ride my motorcycle almost every weekend, I noticed that my neck was starting to flap a little bit here in the breeze. And so the summer was coming up. I knew it was only going to get worse. So I saw Dr. Barnes' ad in the newspaper, and he looked like a great guy. I called up. They were willing to take me in right away, and I went down for a consultation. I was very happy and pleased with his attitude. He explained everything to a fellow doctor, and we were able to do the procedure that day. It took me maybe a couple of days, and I was able to get back on the motorcycle. It was painless, and as he said, people started saying right away, it looks like you've lost a lot of weight, and that made me really happy.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of liposuction or body contouring. With us, we have probably one of the busiest cosmetic surgeons in America, Dr. Tom Barnes. Okay, so
Thank you.
Well known. You've been interviewed by Matt Lauer. You've been on Inside Edition, Entertainment Tonight. You're all over the place. You've been on the new show, The Doctors.
Absolutely.
Do you think it's because of the results you're getting?
Well,
You have a big reputation. Everybody knows who you are.
Thank you. That's very kind of you. I'm fortunate that we've been successful and that we're able to provide our services to help people meet their goals. I know it sounds campy, but it's true. This is a privilege to be able to help people feel better about themselves. And
People avoid things you say, like arms. You were talking about arms at the break.
Well, I have people come in and they'll say, well, what are the options? They'll say, a doctor told me I have to have a surgery and cut the skin, and that scares me. I'll say, I've got Smart Lipo, I've got Tickle Lipo. I think I can get the skin to shrink and you won't need the cutting surgery. We do that all the time. We help people from having bigger procedures and help them meet their goals. Same thing with tummy tucks. I'll have women come down that they actually have a hangover in men, and with my techniques, we're able to get them to shrink
you
up.
You have a photo. Where's that photo you showed me where there's a woman that looks like she needs a tummy tuck?
There are people, and it all depends on the quality of your skin and your age.
Okay.
But I have had people, well, let's show you one right here.
All right.
This is a gal actually is 70, 71 or 2. Now, if you look at that before picture and you look at that overhang, you think, wow, how's that ever going to get better without the cutting surgery? Now, the cutting surgery, when absolutely needed, is needed, but it has higher risks. You usually have general anesthesia or IV sedation, and there's a downtime that can be weeks. Okay, I offered her my lunchtime lower tummy lift, and that's my technique I've told you. Tickle Lipo with Smart Lipo, shrink the skin, and look at that after shot. Okay, that
makes a big difference for her.
The overhang went away 100%. She's able to wear the clothes she wants now. That's a big deal for her.
Very nice. You call it lunchtime just because it's only like an hour procedure in some cases.
People understand.
What do you mean by that?
I created that term actually in 1998 on the Lisa Gibbons show. I did a show called Lunchtime Makeovers. I'd done facelifts on the news. I'd done eyelids on the news and on Lisa's show before that. And when we did the lunchtime show, we did 8 women, little things. The phones came off the hook for a month. You couldn't even call my office. And I said, oh my gosh, that's what people want. Smaller procedures, less downtime, less pain.
But when I always think small procedures, I think, the results aren't there.
Results are there.
These are strong results. I mean, this is good.
Results are there.
So men, you say the wives, the men, they drag their husbands in.
Absolutely,
is that
they
right?
do. Yeah, they'll bring them in and say, honey, have Dr. Barnes look at you. No, and they usually end up doing something because the wife does something.
But now, men, is this something that men weren't doing? They're doing more of now?
Men are doing more. I'd say about 1 in 4 are men now who come in.
Okay.
Who do things because there's changes in our economics now in our society and different cultural opinions about having this done. It's fully accepted now. 15 years ago, they'd say, is this vain? Now they say, how soon can I have it? Men can have the same procedures women have, but in addition, I do the man boobs. We also call them he-hooters. Men that don't want to take their shirt off. They might be a construction worker. They might be an older guy.
That's a bad one.
They might be a young guy. Yeah, I can do that, have them back, having their shirt off. They're proud now. They look better, and their friends don't rib them about it.
That's also, I heard, a very tricky procedure. A lot of guys don't like to do that. A lot of surgeons.
That's what I understand, but we don't have a problem with it. And love handles. For men, very common, lower tummy and love handles. We do that a lot. Very common. And neck. Neck is number one with men.
Neck is big with guys.
Yes.
Now you have from the rear shot. Let's take a look at that.
Okay. We want to take a look at men. What else do they do? Man boobs, lower tummy, love handles. Take a look at those right there.
But this happens to everybody, by the way. Everybody gets love handles.
A lot of people do. And it's that muffin top. Women call it muffin top. Men love handles. And it sticks over their belt. They don't like it. I can take care of it. I have them back to work in a few days.
How many, I mean, could you lose a pant size?
Absolutely. I have people lose 2, 3, 4 inches. 2, 3, 4 inches off their waist, depends. And even smaller guys, you can take a very slender man, there's a picture, and you say—
He looks pretty good on that,
yeah,
on the before.
On the before, you say, why is he doing this?
Just that little area bugs him?
That little area bugs him. We got rid of it.
Interesting.
Yeah.
Interesting.
We help people achieve their goals.
So men, women, and so when should somebody do something about it, by the way?
When they're ready. When they're ready to seek a consultation, that's where it all starts. Because it's desire medicine. It's their
So when
your
it's
choice.
interfering with what? Their daily life, their self-esteem?
All of the above. It's personal. It can be professional. Some people want to look younger, keep their job, get a new job, new relationship, whatever it is, reunion. It's all okay. We're here to help people.
Okay, so a recap on technology, because you're not just, like you say, you're not just sucking.
The day of liposuction is over. It's about body contouring now, whether we do a sculpture technique, whether we do Smart Lipo laser for more tightening, whether we do the tickle lipo technique, and there are other techniques, but I believe we're out of time, so people can call us and we'll tell them.
Okay, great. Well, thank you for coming in. Good stuff.
Thank you, Randy.
Really was good.
Great
Really
to see
was
you
good.
again.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, if you just popped in at 15 minutes, we're going to put it on our site, Dr. Barnes, at wellnesshour.com. Just put in liposuction, liposculpture, body contouring, and what's your term for it?
Lipo-contouring.
Lipo-contouring, or Dr. Barnes. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.